Hello and welcome back to my channel. Hello, if you are new here, thank you for coming. My name is Lanice and I am a nurse and I do these cool little nursing videos. If you are not new here, thank you for tuning in to another one of my videos, and you already know what I'm going to say. Thank you for tuning in to my video, because you could have been anywhere in the world, baby, but you are here with me, and that is greatly appreciated. Okay. So today we will go ahead and get straight into the topic. Today will be another nursing topic, because according to my numbers, you guys love those. You like them a lot more than the other videos. No, I'm just playing, not to be a hater. But we'll go ahead and get into this nursing topic. And I'm not quite sure what I'm going to title this video. However, I just kind of want to tell you guys how to deal with petty nurses or nurse bullies on the job. In my last video, at my last job, I dealt with a little bit of bullying, dealt with a little bit of pettiness, and there are things that I wish I would have did differently, and I just want to come through and share those things with you guys. So the quote of today is going to be, the tallest piece of grass is the first to get chopped. Okay. And that means that if you're usually the most loud, outspoken person, if you're the one that everybody's always looking at, you're usually going to be the first person to get cut. Okay. So, and I think that was a huge issue that I was having at my previous place of employment. I was very outspoken. I was very loud. I was very boisterous. And instead of just coming into work and keeping my head down, I always had to be seen and I always had to be heard, baby. And normally those are the people that are the first to get chopped. So the first tip of advice, or the first piece of advice that I would give to any nurse, whether you're new or old, is to go to work, keep your head down, and just do your job. I'm not saying to go in and be a mute. I'm not saying go in and not have any type of personality, but what I am saying is that bite your tongue sometimes. Don't be the first to speak out at the meetings. Don't be the first to go back and tell anything. Like, you just need to keep quiet and do your job, because at the end of the day, that's what you're there for. And these companies, they don't care much about you. They want you there to do a job. And if you don't like the job, leave. Honestly, that's probably the best advice I can give you. If you don't like the job, then leave. Now, again, anytime I come on here and I share tips or give any type of advice, please always remember that this is from my own personal experience. And this is how I want to move in the world, or in the world of nursing, or in my career. Okay. So that would be my first tip of advice, just to go in, keep your head down, and do your job. My second tip would be to be fake. Yes, I know that that's not what you guys wanted to hear. No one is ever going to tell you to be fake. But baby, would I tell you that the nurses that are usually the most happiest at their jobs, or the nurses that don't normally get called into the office, are the ones that are being fake. And I don't mean fake as in going around and talking about somebody behind their back or being two-faced, but I mean smiling, being cordial, and being nice to people, even when they really deep down don't like them. And I think that being fake is also, sometimes it's just good customer service. And as a nurse, you have to provide good customer service. And you have to have a little bit of fakeness in you to have extremely good customer service, because the customer is usually always right. Okay. And so no matter how you feel on the inside, you have to move from a place of the patient is always right. Your DON is always right. You just have to kind of move from a place of fakeness. So again, when I say fakeness, I don't mean being a two-timing backstabbing nurse. I'm saying go to work, be pleasant even when you don't feel like being pleasant. Be nice to patients even when you don't feel like being nice to patients. And most importantly, be nice to the people that you work with, even if you do not like them. Even if you do not like them, be nice, be cordial, just be fake. Just be fake. And I promise you will have a much better experience. Okay. The next piece of advice that I will give you guys is to realize that jealousy is a real thing. And we all know that nursing is a female dominant career. And us as females, we are wired to be emotional. We are kind of wired to be envious. And we are wired to compare ourselves. And in this field, that is a recipe for disaster. So I say that because you have to look at it from both sides of the coin, whether you're the person who is jealous or you're the person who is someone is jealous of. It's not good for either person, okay? And you have to realize that jealousy is a real thing, whether you're the person who is jealous or you're the person who someone is envying. Because if you are the person who is jealous, you need to realize that about yourself, that the things that you're doing to this nurse, the way that you're bullying this nurse is just out of jealousy. Whatever it is that you see in that nurse that you're envious of, you too yourself can have, or be, or do. But everybody doesn't look at the world like that. And jealousy usually makes for a miserable person unless that person is extremely self-aware. And even though we are nurses and we work in a field that is that requires a lot of self-awareness, you would be surprised how many people lack that. And then if you're on the other side, if you are the person who someone is envious of, that's a recipe for disaster for you too, because a lot of times when people are jealous of you, you don't even realize that is their motivation. You don't even realize that they don't like you out of pure jealousy. And at times that can make you beat yourself up. At times that can make you question yourself or make you wonder what's wrong with you. And a lot of people can gaslight you into believing that you're the problem when you may not really be the problem. They may just be jealous of you. And I'm not speaking to any specific certain situations here, because you never know who may watch these videos. And if I have worked with you before, and this video is pinching a nerve, it's more likely because a hit dog will holler. Okay. But I say that to say I'm not speaking to anyone directly. I'm just going off of what I've learned. I've been working as a nurse for 9 years now, since 2014. I got my LPN in 2014. So I've encountered a lot of people. I have been jealous of people. I have been a bully to people. I have also been on the other side of things, because karma is real. So I just say this because I want us all to be more self-aware. All right. So tip number 4 for me would be to address the problem at the time. Do not let it build up. Do not let your aggravation build up. Do not let the bullying build up, because if you continue to let someone bully you, guess what you're going to get? You're going to continue to get bullying. You have to teach people how to treat you, whether it's romantic, familial, or professional relationships. You have to teach people how to treat you. So address the problem at the time. If you have a preceptor who you feel like is mistreating you, talking down to you, being impatient with you, address it in the moment. Because a lot of times, if you wait till later on to try to address something, people will forget what they did, or, or they'll ask for an example. And if you are like me, and in the moment somebody asks you for an example, you go blank because you're already nervous for being put on the spot, and you forget the examples that you probably had a whole list for when you were talking to your friends on the phone. But you forget that whole list of examples. If you're anything like me, you need to address the issue in the moment, because that will be an example for the person. Okay. If you continue to let things build up, your brain almost erases some of the stuff sometimes, you know what I mean? So just address it in the moment. And if at that moment you address it, you guys come to an understanding and there's no compromise, the person isn't seeing your side of the point of view, or the person doesn't change the behavior, then go get management. Because, like I said, there are a lot of people who are not self-aware out there who are nurses. So you may need a mediator. You may need management. And the last tip that I would give you guys, and I'm only telling you this because I've had to do this myself, is know how to contact HR. HR is not there to pick a side, because HR is there to help the company, to protect the company. And there are a lot of people out here that sue these jobs and sue these businesses that they work for in the past. You see a lot of employer litigacy or whatever. I don't even know what word to use, but a lot of people, I see a lot of people making a lot of money from suing their employers. So HR is there to protect the company. They're not there to protect your manager. They're not there to protect your other fellow nurses over you. They're there to make sure things are handled and mediated in the right way. So I would say my last tip for you, and I think is very important, is to know how to contact in the case that you ever may need to contact HR. Okay. Honestly, right now, without giving you guys a whole bunch of story times or without going into too many details over different situations that have happened that have led to this list for me, without sharing all that stuff, this video is actually quite short. So I said that to say I don't really have any more tips for you guys. If you do have any tips for anybody and I missed one, please comment down below. Put those tips in the comments. If you enjoyed this video, I ask that you please also let me know in the comments. And if you have not already subscribed to my channel, like this video, or shared it with someone who you think could benefit from it or enjoy it, please go ahead and do that, because that's what keeps me going. That's what lets me know that you guys really enjoy my content. So I'm gonna go ahead and head out. This is going to be a short video for today. If there are any topics that you guys would like for me to cover, I ask that you also comment that down below, because I love to talk to you guys. Okay, I really, really do. So again, if you forgot my name is Lanice. I am a nurse and I do these cool little nursing videos. And right now I'm gonna head out. Peace.